Thanks for giving me the opportunity to speak today. I'm representing Canadian Association of Physicians for the Environment, which is a group of physicians and other health professionals that are concerned about environmental effects on human health. And I work as a family doctor. I work in Kingston in the Family Medicine Center at Queen's University. So when I looked at this environmental assessment, I was surprised how little mention there is of health and how little addressing there is of the controversial health issues around nuclear reactors. And what I read was what I've heard frequently from the nuclear industry and also from the Ontario government, that there are no risks and no worries regarding health around nuclear reactors because the chronic low-level emissions that are emitted on an ongoing basis from reactors are too low to be causing illness. And I'll describe as I go why I disagree with this. And my feeling is, and I'm representing CAPE, this group of physicians and other health professionals and citizens, that the Darlington refurbishment should not be approved until these health issues are appropriately addressed, which they are not presently in the environmental assessment. There are many issues around health in the nuclear industry, and this is some of them. And I'm not going to get into too many details because what I'm really concerned about mostly is these low-level chronic emissions that are constantly coming out of reactors. Scientists worldwide basically now accept what's called the linear non-threshold model of health and radiation exposure, which means that any amount of radiation is harmful. So even background radiation is causing illness in everybody. Or elevates the risk of with everybody. There's a recent study from out of UK. They looked at lots of models and measurements, and they estimated that about 20% of childhood leukemia is attributable to background radiation. So even background radiation, which is natural, is still causing leukemia in children. We know that children are extremely sensitive to radioactivity. Some studies estimate as much as 100 times more sensitive than adults. Women are more sensitive, and embryos and fetuses are exquisitely sensitive to the effects of radioactivity, which makes it extremely important that pregnant women be protected against any unnecessary radioactivity. We also have to accept that we don't understand everything about this. So when we say that these chronic low-level emissions can't be causing illness, we have to admit that we don't know that. So when you look at the studies that have been done, they started out in the UK in about the 80s when people started to be concerned about seeing a lot of children getting leukemia near their facilities. This prompted the COMARE studies, and there have been, I think, 14 or 16 of them since the late 80s. Some of them have in fact, shown an association between leukemia, childhood leukemia, and reactors. Again, they're small studies, they're ecological studies, which are not very good type of studies. But nevertheless, they have, some of them, shown a concerning relationship. These have been replicated in other European countries. We've done very few studies in Canada. A couple out of the late 80s, early 90s. Only the one that we have done is Radiation and Health in Durham region, which I'll talk about in a minute. That came out in 2007. Since then, better studies have been done. The KIC study out of Germany and the GeoCap study out of France, which have basically shown that there is an increased risk of childhood leukemia in children living near reactors. But the Radiation and Health study, which is really, like I said, the only one that's been done in Canada, has many, many weaknesses and limitations. First of all, it's an ecological study, which, as I said, is the weakest form of study. The radius is up to 10 kilometers around the reactors that the population they studied, which is long. They don't take into account any migration out and in, and there has been a lot of flux in population. The numbers are small. They also define a child as being under 19 years old, so any increase in really little children under 5 is not going to be shown. They had to pool the congenital anomalies, which are birth defects, because there's so few of them. And then again, if there's an increase in any one type, it's not going to show up on a study like this. They're also missing the first 5 years of data after Pickering opened. So despite all these limitations, they did show some increases in different types of cancer and an abrupt increase in combined cancer after Darlington opened. as well as an increase in Down syndrome, which is concerning because we know that's radiosensitive. The authors concluded that this required further study, which has not been done, but then they went on to try and reassure everybody that there are no health effects. In 2008, Germany did a very robust study methodologically. It's a case control, which is a much better type of study than an ecological study. And they looked at children living near all 16 reactors at different radiuses around the reactor. And they found that children under 5 living within 5 kilometers of every single one of those reactors had up to twice the risk of developing leukemia. This study was replicated, by GeoCap, which came out earlier this year in France. They did the same kind of study, case control, and they found that children under 15 living within 5 kilometers of every one of their 19 reactors had an almost twice the risk of developing leukemia. Now, the German and French governments and the nuclear industry, of course, didn't want to really find this out, and they scrutinized it inside and out and did conclude that, in fact, there is an increased risk, but they insist that it's not related to the chronic low-level emissions. And it must be something else. But there are explanations for these low-level radioactive emissions to cause childhood leukemia. One is that, as I said, children are way more sensitive. Some think as much as 100 times more sensitive. That in itself could explain it. There are also long half-lives to some of these emissions. There are spikes in the emissions, and we have to perhaps look again at how we're measuring how we're modeling the measurements of exposure. So tritium, as somebody had mentioned before, has a half-life of 12 years. This means it's around in your body for 120 years. You only lose about 5% of it per year, which means that it accumulates. So every year, if we say that you have a certain amount of exposure coming out of reactors per year, you have to remember that 95% of it was there from the year before. So it's constantly accumulating. Some of these emissions have very long half-lives. So this could explain why low-level emissions cause leukemia in children. Also, when we're given the annual amounts of radiation, it's either averaged out or it's added up and we get an annual amount. But as this is a graph that shows a power station in Germany just a few days in September. As you can see, it's very, very low, and then there's a massive spike, about 500 times what the low level is, and then it goes back down again. And this occurred when they opened up the reactor to change the fuel bundles. So granted, in the CANDU reactors have online fueling, but there has to be at some point a time when they open the reactor and change the fuel bundles. And we don't know, because we are only given an annual total amount, we don't know if there are massive spikes around here, Darlington or Pickering, until we see daily measurements. Another problem is when we're looking at tritium, there's a lot of controversy about how it's the effective dose that's measured. We know that the amount of radiation, but these emitters go through a whole series of calculations to determine their actual biological effectiveness. In other words, how much it's affecting a person. And some of the very respected radiation biological agencies worldwide have suggested that we need to change the weighting of tritium, that it's actually much more dangerous than we think. So if we were to change the weighting from 1, which is what it is, to 2 or 3, which in fact is what Environment Canada had recommended in the early 2000s, this would effectively double or triple the emissions that we've calculated. This could explain children getting leukemia near reactors. So CAPE recommends that the CNSC should publicize daily readings of radioactive emissions instead of just giving a total amount, so the public is aware of the spikes in emissions. Also, the CNSC should comply with recommendations to change the weighting factor of tritium from 1 to 2, even 3, which would double or triple the measured dose. And the CNSC should undertake a large case control study of childhood leukemia within 5 kilometers of Pickering and Darlington reactors. All these things should happen before any environmental assessment is approved and before the refurbishment goes forward. We have reliable research showing elevated risk of leukemia in children living near reactors. as I've explained, we can explain how low-level chronic radioactive emissions are causing this leukemia, and we have to remember children with leukemia are canaries in the coal mine, that if they are getting leukemia from reactors, it's a given that it's harming other people too. Thank you very much.